What causes health? What causes disease? Those are the two really foundational questions in different healthcare perspectives or paradigms. Now, the what causes disease, that is where our healthcare system functions. And I use the word healthcare, that's what we call it, but it's really sick care. And I'm so thankful that we have it. Some of you know I was sick and in the hospital in 2019, and they were able to assess me immediately, diagnose what was happening, be able to help me right away, get me out of a crisis. Now, what you realize, and what I knew at the time, was that they weren't creating health or producing health and better function, but they were helping me get out of crisis. And then when I get kicked out of the hospital, then it's the time to really start healing and repairing, rebuilding. And of course, as you guys know, that takes time. Now, chiropractic is the study of what makes someone well. We know that our brain controls function, healing, and cell replacement. And so our job, of course, is just to make sure that our brain can talk to our body. But the side effects are things like someone has fewer headaches, they have less back pain, they can run faster, they digest without cramps or pain, they don't have tingling in their arm anymore, they can bend over to tie up their shoe, all those things. So chiropractic is not a treatment for any of those symptoms, but those are really side effects of a higher level of function and healing. And the real measure of nerve function and nerve system function altogether is when there is a crisis, when there is stress, when there is a trauma, how well do you heal? Like if you do some gardening today and you don't garden, and then tomorrow you wake up, you wouldn't be surprised that you'd have some low back pain, or maybe your hips or knees or your legs are a little bit sore. It's different than what you normally do. But if you had that pain in 6 weeks from now, that would be a huge problem because your body should have healed and repaired by this point. That's the idea. There are stress, it was a different thing you did, but how well did you heal after that stress happened? Now, the whole idea of creating health is called salutogenesis, and that's a big long word. Actually, I only heard that word last year, and I've been a chiropractor for over 15 years now. But the concept is simply this: how do we continually invest into our health? Because when there is a stress again, you need to draw from those reserves. Think about it as like a financial investment. There are times when we need to draw some of that when there's more of a crisis or a stressful situation. The other part of that too is in that salutogenesis model is that stresses are not necessarily bad. Think about that one for a sec. Because in our medical system and even our thought process along those lines is that any kind of stress we need to avoid. So if there's a physical stress, get away. If it's a mental, emotional, chemical stress, get away from it. And some of those are certainly bad. You can never make a good argument for something like, I don't know, smoking, for example. But the stresses, and especially the emotional or sometimes relational ones, actually can teach us things about ourselves. We can grow. There's things we can gain. Even pain. Again, I don't want to be in pain. I don't want you to be in pain. But there are things that we can learn about ourselves, and there's lots of those in history of someone suffering from a certain condition or challenge, or Helen Keller is an extreme example of that. But there's so many things in their life that happened because they had that challenge or that stress. And again, I'm not requesting those. I don't want those to happen to you either, but they are sometimes ways for us to learn, grow, build that we wouldn't have done otherwise. And even right now, and I'm not sure when you're getting this email, you might get it a little bit later on, but even right now during this pandemic right now, we can take it as everything's terrible, the world's imploding, or what's different that we can what is different that we can do, or how can we reassess how we do school, or how we deliver tomatoes at the grocery store, or all those different things. How can we step back a little bit and go, maybe we can do this differently or better or more efficiently, or just in a more relational way. So sometimes the stresses teach us something new that we didn't think of already. The other one that's really important, I know that this is going long, but the other one that's really important is you are responsible for your health. In that salutogenesis concept, that building of health, you're the one responsible. And again, people can help you get out of a crisis or give you some direction, but ultimately, if you're supposed to do some exercises that you were given and then you don't do them, well, then you choose to do them or not. And then you brush your teeth or you don't, and you go to bed on time or you don't. And you make all those choices yourself. And there are people who can give us some direction and some assistance with those sort of things, but ultimately it comes down to you. And the idea, I think decades ago, was that You do whatever for your health, you eat whatever, and whatever life looks like, and then at the end there's some kind of magic bullet or someone that's going to save you and save your life and extend your life, and it goes completely against this concept of stewardship, which is this is your resource to serve people, to have relationship, and so how do you take care of that well to be able to do those things? And so there's a few thoughts, and hopefully that makes sense. If you have questions, don't hesitate to contact me, but the salutogenesis is that real concept of how do we create health, how do we build into health over a period of time, not just simply when we're in a time of crisis.